Atherosclerosis, as you know, is the commonest cause of the killer disease, heart attacks. And the advancements in interventional cardiology has given us tremendous scope for saving people's lives. When people come with heart attacks, we do primary angioplasty and stenting as an emergency procedure, and we are able to save more than 96 to 98% of these patients of late. We can do angioplasties in bifurcations and branching vessels, in the left main vessels, in chronic occluded vessels, in small vessels, and we can do angioplasties even in youngsters as well as in very elderly 90-year-olds as well. Apart from coronary interventions, we also can do a lot of justice to patients with heart valvular diseases. Now we can do simple transcatheter procedures like changing the valves using TAVI or TMVR, or even closing holes in the heart with ASD devices or paravalvular leak closures. Another important challenging disease has been the aortic dissections and aortic aneurysms, which once upon a time were only surgical. Now, with advancements in endovascular stent grafting, TVARs and EVARs, we are able to treat these diseases in the majority of people with transcatheter techniques in a very simple way without opening up the patients. Device therapies with pacemakers and CRT has also been my additional field of interest, and patients with arrhythmias, the slow heart rates, can easily be tackled with the most advanced pacemakers of late. We also deal with cases of refractory hypertension. There are people whose hypertension or blood pressure will never be controlled despite using 5 or 6 drugs, and we have innovations in the form of renal denervation therapy, also called RDN, wherein we can put in catheters into the kidney blood vessels and give some radio frequency current so that the blood pressure can be controlled in these difficult to treat hypertension patients as well. Other advances which we are treating are the rare heart diseases where coronary arteries develop aneurysms, which once upon a time were almost catastrophically mortal. Now we are able to deal with them with covered stents. We are able to put in coils and then close these aneurysms without recourse to surgery. Medical management of heart diseases also has taken tremendous advances, and that also gives us a lot of encouragement in dealing with a wide variety of gamut of patients.